Good afternoon, everyone. Thank you for being here. Thank you for coordinating your schedules. We had to go a little bit later today than we normally do. Unfortunately, we have lost 2 more people to COVID-19 in our community. A male in his 70s and a female in her 70s. Both had underlying health issues. We just want to think about their families and the families of everyone we've lost in this process, and grieve with them as a community. This is the stark reality of this virus, that it preys on those with underlying medical conditions, and again, our thoughts and prayers are with everybody, and we continue to grieve as a community. When we look at those who we've lost, 22 are Caucasian, 2 are of another race, and 1 is African American, 14 females and 11 males. When we look at our positive cases, reminder, a positive case is a positive from the first day we had cases on March 16th. We now have 746 positive cases, up from 724 yesterday. That's 22 new cases. Our hospitalization rate has gone down. We now have 39 individuals in the hospital. That's down 3. ICU has ticked up a little bit. We now have 14 individuals in the ICU. Let's think about them and make sure to pray for them as well. Further detail on who's in the hospital. We have 20 Caucasian, 10 African Americans, 3 neighbors of another race, and 6 neighbors we just don't have the demographic information on at this point. Today, we've had the best day yet related to recoveries. We have 485 people who have recovered. That's up 63 people. So let's look at the data. 746 positives, that's our red curve. We are presently monitoring 236 active cases, that's our yellow curve. That is down 43 cases from yesterday. Very good news in that regard. That might be the lowest it's been since we started having recoveries. We would have to look at that data point, but certainly a very good day related to active cases. We now have 100 individuals, our contact cases, out of our number of our 746 number. 100 of those are contact cases. So those are household contacts. That's up 3 from yesterday. So we're now looking at not just positive cases, but under what conditions are they really positive. A contact case, that's somebody we already had in a quarantine situation. Does not take as many resources. We don't have to go figure out who their contacts were and investigate for the most part. 8 of our 22 cases are affiliated with senior living facilities. Our proactive testing strategy. Essentially, we're going into areas where we believe there's probability of more COVID-19 and trying to find individuals that otherwise would not be tested. We've been doing that. We've been finding new cases, critical to stop the spread and to identify, fact find, and then quarantine. So when we take out the 11 cases off of our 22, 11 of our 22 cases are community spread. That number, the community spread, has been going down. That's very important. That's where your social distancing helps us by doing what you're doing. It's working, so thank you for that. We now have 890 individuals in an isolation or quarantine. That's both our positive cases and any contacts and any direct contacts. Let's break out some of the demographic data. 414 of our cases have been female. 332 have been male, 26 are under 19, 140 are in their 20s, 106 in their 30s, 115 in their 40s, 130 in their 50s, 111 in their 60s, 60 in their 70s, 41 in their 80s, and 17 in their 90s. 22% are under 30, 36% are under 40, 52% are under 50, 69% are under 60, and 31% are over 60 years of age. I'm now going to give you two sets of data. I'm going to break down by municipality how many cases, and then I'm going to break down how many active cases they currently have. City of Syracuse, 341 total cases, 153 current active cases. Town of Clay, 79 total cases, 25 current active cases. Town of Manlius, 50 cases, 16 active cases. Town of DeWitt, 41 cases, 15 active cases. Town of Onondaga, 40 cases, 19 active cases. Town of Salina, 38 cases, 8 active cases. Town of Camillus, 33 cases, 5 active cases. Town of Cicero, 26 total cases with 2 active cases. Town of Gaddis, 21 cases with 4 active cases. Town of Lysander, 20 cases with 4 active cases. Town of Pompey, 20 cases with 2 active cases. Town of Skaneateles, 14 cases with 3 active cases. Town of Marcellus and Atisco, both with 4 cases each, now have 0 active cases. Town of Van Buren, 4 cases with 2 active cases. Town of Lafayette, 3 cases, 1 active case. Town of Elbridge, 2 cases, 0 active cases. Town of Fabius, 2 cases, 1 active case. Town of Spafford, 2 cases, 1 active case. And Town of Tully, 2 cases with 0 active cases. That's a data point people wanted to know. That's a data point people should not feel comfortable in, though. The virus is still here. We had 11 contact cases of community spread, randomness. That means they have symptoms. They're contacting their doctor. They're meeting CDC guidelines. They're going. They had people who they were in direct contact with. We had to quarantine those people. We're getting better every day, but this is not time to celebrate the success and not social distance. Let's celebrate success as a community. Let's continue to social distance. Testing. In these numbers, we have Walmart positives. We've talked about the Walmart site. We now have the positives in this data. I do not have the negatives in this data. So the percentages, when we receive all the negatives, will get better related to positive to overall total. But let me go through the testing. 9,445 tests administered, and we have had 259 tests completed since yesterday. Again, part of our proactive strategy. 9,163 tests have been returned, with 746 positive and 8,417 negative. 282 tests are pending. We've received 189 tests back since yesterday. Again, not in these numbers are the Walmart site negatives, but the positives are. 8.1% of those tests that are positive, we expect that percentage to drop a little when we get the negatives from Walmart. Again, out of our 259 that were completed, the majority of those were related to proactive testing. We've seen your standard symptomatic testing related to being referred by a doctor or through the triage center. Those numbers have decreased. We believe that is positive. That's why we're seeing less cases related to community spread. After a positive test, our health department's going to contact you. They're going to check in on your health, your symptoms. You should also hear from your primary care provider if you have one. At that point, we start our investigation. We try to determine who your direct contacts were, not only since you've had symptoms, but days before. At that point, we reach out to any direct contacts. We then put them into a quarantine. Just because you have had, you work at the same employer as someone who's been positive of COVID-19 does not mean you're in direct contact. If there's any gaps in that investigation, we're certainly going to let the public know. We will put out a press release. You'll hear me talking about it, asking the public to be aware, to monitor their health. Again, we're in a community that's had COVID-19. We've had it for a while. We need to always monitor our health. I want to thank all of those who continue to work with our health department on our website to use the technology to update their health statuses for us. That allows us to really streamline, get you out of quarantine, potentially isolation, excuse me, based off of this. Allows us to look at the data, then qualify the data, reach out to you. Very important part of that. And again, no one is released from a quarantine or from isolation without our health department led by Dr. Gupta. Voluntary shelter in place, remember we started that with social distancing. We went through that as a community. We rallied. That worked. Our data has improved from that standpoint. We are no longer in a voluntary shelter in place, but we are asking you to continue to social distance, do better than you did the week before. It's important, especially when we're looking at starving this virus. That's what this is all about. It's a mitigation tool, one that you can help us with, and one of the only mitigation tools we have in this fight. So I want to thank everybody for everything you've done. Part of the success we're seeing now is because of you. So again, social distancing is working for us. Let's continue to do it. Certainly it's going to be part of our world, our lives moving forward as we enter into new phases in this fight, into what are new norms for all of us. We've talked a lot about Restart. We continue to work with our regional partners, our business community, our healthcare partners, putting together ideas and concepts of how we can restart our economy locally, at the same time working with our public health departments so that we don't give up the ground we've made. That's critical. We've talked about a phased-in approach. We've talked about key metrics that we need to get to before that can happen. We continue to work as a region in Central New York with our region that's so connected to us with the Mohawk Valley. And we are hopeful that we will have a document that we can get to the governor and his team who are working so hard on the same topic for feedback and eventually approval potentially. So we're excited about the progress that we're making and the collaboration we're seeing with counties and cities, with counties working together. We will be working together more with our public health departments, with our emergency management departments. We'll do so much more together now because this virus has brought us together. When we look at access to assistance, the Upstate Triage Hotline, 315-464-3979. Again, you call this hotline to get your symptoms checked, to potentially go get a test at our triage testing site at the Syracuse Community Health Center. Our seniors, our healthcare workers, and adult nutrition hotline. This is a hotline for you if you need help, you find yourself needing a meal, needing help groceries because you couldn't get to the grocery store, toiletries, 315-218-1987. Child Care Solutions, our partner for daycare for essential business employees, so that we limit the contact with grandma and grandpa and we fill gaps in child care. 315-446-1220. Again, this is daycare free of charge if you get stuck with child care issues and you're an essential employee. We've talked about how real this challenge has been to all of our mental health. Certainly, please call 211 if you have social and emotional support that is needed. You need strategies, whether it's for you or your children. This is something that we're all struggling with, and we're struggling with. Let's do that together. Let's utilize the resources available to us. Saying that, I'll be happy to take any questions.
Can you give any more detail on the discussions with other county leaders about a restart? How many more meetings do you think you have to have before you're ready to submit a document?
Yeah, I think we're going to have some more discussions. I think we're getting very close to, with all the feedback we've had and really looking at things, and now we're really diving into potential industries and what some of the regulations might need to be, really diving in and giving a very thorough document to the state as they're looking at their own process, and then that starts a conversation and some idea sharing. So we're very happy where we are with the collaboration. Our conversations with New York State have been very good, very professional, great partners. So we're happy.
Part of that is to lay out a series of phases, right? That some things would open first. How many different phases have you all kind of envisioned?
Yeah, I think you're looking at probably a 3-phased approach, and then you figure a healthcare trigger that any limitations in that 3rd phase go away. But you're really looking at the when is the health data that drives the when. Then you have your phase 1. Then you have a lot of, you give yourself time after phase 1 to assess cases. Where are the cases coming from? Are cases going down still? And we just gave more density to the community. And you let your health department and your healthcare infrastructure, your data, your tracing teams really come up with what they're looking at, and you really rely on them to implement phase 2 at that point. Then you implement phase 2, and you do the same thing after phase 2, and then you're going towards a phase 3. So this process, we're in a position to have this conversation and put forward a proposal, a plan that makes sense for our region based off of our unique economic conditions because of the data we're seeing, not just for Onondaga County, but for the region. More recoveries, less active cases, pretty flat new cases. We're not going to get to a point where there's going to be 0 new cases in a likely timeline where we can keep everything shut down. So for those individuals who want to see 0 new cases before anything else starts up, we got to remind people that there's business going on now. We need to test this virus at some point and learn from that, and that's what phase 1's all about. And Dr. Gupta and all of her peers have had lots of conversations. They've been vetting everything that has been coming up, and we're not doing anything that our health commissioners would be uncomfortable with. I think that's what everybody needs to understand.
I know you don't want to get too far ahead of the final document, but just so people have an idea, what kind of business might be included in phase 1? Is it going to restaurants in person but wearing masks? Anything you can give?
You're good. So Prosecutor Donovan's back at it today. You don't want to get too far ahead of phase 1, but you want me to tell you what phase 1 is. Look, there's certainly essential business with certain regulations that would hopefully fall off. There's other businesses that we're not going to specifically talk about any of this because we don't want there could be disagreements about what that looks like. We don't know if that's going to happen, so we're not trying to box anybody in. We're not trying to give hope to anybody. What we're saying is that our region has done well, and it merits this conversation to see a Central New York, Mohawk Valley restart potentially before other parts of the state. So I don't want to put too much detail out there because that may never happen with that company under that timeline or that industry. And certainly I'm not going to try to box in the state of New York, who's been a great partner to this point.
Federal government just signed off on a $458 billion bailout plan for people and businesses, but none of that money is earmarked for local governments, which are under a lot of strain right now. Would you like to see the federal government step in and earmark money for local governments?
Yeah, look at it this way, okay? We're one of the county's largest employers. We're one of the region's largest employers. We're the ones fighting COVID-19. So if you want us to be able to do what we've done and attack a virus and get tremendous gains, save lives, I need money to pay people. People don't do this for free. So my health department doesn't work for free. Dan Weirs is here, my emergency management coordinator. He doesn't work for free. I mean, maybe I can cut a deal with him, but that doesn't happen. So the reality is the relief being given to business was about keeping people employed. How are we different? We're not. The relief you're going to give to us is about keeping people employed. Just like business, I have to have a balanced budget. We had a balanced budget. The last 2 years, we had surpluses because we ran an efficient government. We do not have a deficit now or whole because we made a bad decision at the local level. We've been making good decisions. That's why we've had surpluses. That's why we've been cutting property taxes every year for the last 9 years. So what has happened is our revenue has been shut down because both the federal government, the state government, and the local government agreed we needed to shut things down. So I've heard some politicians make some comments lately. I'm going to give them the benefit of the doubt because I've been cranky sometimes. And I think maybe they had a cranky day and they didn't really mean what they were saying. But to not give state and local governments help when the federal government was recommending to shut down is nuts. So we need help. We get help. We keep people employed. We continue to fight COVID-19. We help with the recovery to create more receipts. And remind you, all these employees pay federal income tax. So that's money that's going to go back into the federal coffers to pay this stuff back. But certainly we need help. And when you look at the governments impacted, we've been impacted the most. Head over heels. County governments are impacted more than any other governments at the local level. Our sales tax take a bigger hit, and we're the ones spending all the money.
Have you had conversations with any of your federal colleagues about this?
Yes, Congressman Katko has been tremendous. Senator Schumer, fantastic, great allies, and Senator Gillibrand as well. So we've had a great CNY delegation working on this. Certainly, I hope that they recognize the level of the hole that we have, and that's reflected in any potential bill. But certainly, any help is appreciated. Recognizing the special role we play in this is certainly merited.
You said yesterday you're going to work through the weekend with these county meetings, this task force. Do you foresee wrapping up early next week and getting a document to the state next week?
We've been working very, very hard, all of our teams, really looking through the regional lens, then looking through our specific lenses within our economies and everything. How do you regulate it? And then once you come up with that, then you let your regulators, our health departments, look at it and say, can we track COVID by doing this? Where do you have concerns? I have concerns here. That can't go here. It's got to go later. Okay, that's kind of what's going on. We get input from the business community, hospitals. We come up with stuff on paper. Dr. Gupta and her team and her colleagues look at it because it's all about them being able to track COVID-19 in real time so they can identify and isolate. And then we have the capacity now. Somebody goes to get a test, we're getting a test back 24 hours, right around then. And so if we ever needed rapid testing, we have 3 hospitals that can give us rapid testing right then and there. So we're getting to a good spot, but it's all about being able to, it's not going to be just everything opens up at once. There's going to be businesses that will be allowed to be opened up at some point that are still going to have their employees stay home because that might be the new norm. People can get their job done from home. So why wouldn't you do that as long as you can until you know and you see how this virus behaves? And so that's kind of a background on some of the sausage making.
So a document next week?
I think so.
Two of the challenges on the health side of that have been acquiring PPE and developing this army of investigators or tracers. Can you give us an update on how those are coming?
Yeah, so our COVID-19 tracking team, Dr. Gupta has given us her plan. We will approve her plan. We're very interested to learn more about some of what the state's talking about with the Bloomberg team. That's interesting to us. Maybe we can incorporate some of that into we want to incorporate whatever the state's doing there. Mind you, all tracking is going to be coordinated with the state health department, just like it is now. Early on, remember you guys were asking me questions about, we heard Monroe County had somebody go there who was positive. They're at a bus stop here. We get called by the state. They let us know. So that type of tracking will go on with our state health department partners as well. And so they'll have to iron out how that works with this new tracking. But Dr. Gupta has given us a plan. I've approved that plan. That's going to cost us money.
How much?
I'm not sure the exact salaries, but you're at least $1 million.
New employees?
New employees.
How many?
Probably a team, looking at probably a 10-person team right now, Tim.
10 in addition to what you already.
Correct.
Do you foresee the structure of the health department permanently changing? Is that what this conversation is about?
I think you're going to see governments have to really look at the way we operate and restructure. And there's been a lot of cross collaboration in different departments that traditionally just did certain things. I think that's going to change. I think there's going to be a new appreciation for planning and preparing for these events. Dan Weirs is smiling in the back of the room right now. I don't even need to look at him. Nobody knew who Dan was before this. Now he's a rock star. They're going to make a donut for Dan soon. And so these are things that, this is something that we never thought about, pandemics before. And once you see it happen, you see how fragile and how vulnerable we really are to many different things. So this is going to have to be a way of life moving forward, is recognizing how important some of these proactive things that we never really thought about or paid as much attention to as infrastructure and some of the economic development. This is a big deal. It's our #1 asset, our health.
How involved has the state been in those conversations you've had with the local county leaders?
Yeah, I've been keeping the state briefed on our progress. So we have our conversations coming up with our plan. Then we want the state to look at it, and eventually we're gonna come up with. Hopefully, the state likes what they see. We're part of New York State, and then it's really our plan. Then, right? Our plan, state, counties, regions. So we've had calls with the state, keeping them briefed on everything, and getting feedback on some preliminary things. So we're excited about that partnership.
Is acquiring PPE still a difficult challenge?
It's a challenge, Tim. I think it's getting better. There's more sources. It's timing. So the challenge with governments who are, you're really tasked traditionally with watching every dime you spend and quantities. What do we need now? How do we do this? Turn times. We're being more liberal in how we're buying PPE now, knowing that you might not get all of it. Some of it might not be exactly what you thought you were getting. But certainly, for example, we received a lot of masks in. We're going to be getting these masks out to certain communities, vulnerable communities. We're going to be getting masks to the Syracuse Housing Authority, to La Liga, some of our New American communities, other senior-type housing. We're going to then try to get masks to other areas, other senior centers, other areas where they're lacking, potentially looking at some of our other continuity of operations, getting masks there to get to kids, get to people. So we bought a bunch of them. We got a bunch in. The state gave us some. So now we're going to get those out in the community, right? Being proactive. So that's one side of it. The PPE that's really needed at the nursing homes and the hospitals. The gowns were tough this week, right? We had a problem with gowns. You put big orders in 2 weeks, you're going to have more gowns than you needed for a period of time. So that's kind of how it goes. But I think overall, we're doing better, certainly, now than we were at any other point in this process.
How are supplies for the nutrition hotline, food, and I know styrofoam containers and things you need for that setup?
Good. A lot of that's based off of working with the food pantries and the food bank. Sometimes we get business to local restaurants as well through that when there's gaps. But that's going well. You know, again, a new service. We weren't doing this before. This is not your Meals on Wheels. That still goes on every day. Those folks have been receiving that service, are still receiving it. These are new individuals. So that's going great. And our team, army of volunteers and county workers have been doing really well with that.
Is there a new need you've identified where people who want to help out can step up in a different way?
You know, there's various things that happen throughout this process that come up, and a lot of our conversations, you're trying to forecast what that new need will be as you have a restart too. So that's kind of always a moving target. and we're certainly trying to stay ahead of that. As you're looking at people going back to work, some people, even if they're younger, might have different underlying medical conditions, and there's a lot of stress there, and how can we work with employers in that? And so there's a lot of these things that you start to think about and to try to address. And I get a lot of emails from people who have these situations, and they're very concerned, and that helps us. They're concerned usually from a point of view, and that helps us think about how to address that specific concern. So that's going to be an evolving process as we're in this new norm where things we traditionally don't do, we're now having to do to fill that gap.
Have you guys started working on a post-COVID-19 county budget? And if you have, what does that look like?
I've not gotten a report on what we're paying in our health department right now. Maybe I should ask for that, but it doesn't matter. Our health department employees are working 24/7 fighting this, and they're just fantastic. But we've trimmed our overall budget. We've held vacancies. We've essentially eliminated hours on our 103 line. We went into austerity spending in spending lines that you normally use 8 to 10%. So at the local level, we started this right when this started. So we know right away we can absorb a big hit. We just can't absorb a type of hit that we think is coming. So that's where we have a retirement incentive that the legislature approved this past session. That will get people out the door, and we don't need to fill those positions. That will save us a little bit of money this year, but really help us more next year. But you know, we're mostly people in government, and if the goal is to keep people employed, we're going to need some help.
Roughly how many masks are you going to distribute to the community, and how's that going to work? Are you going to choose places, or are they going to ask for them?
Right now we've identified vulnerable communities right now already. We talked a little bit about some of those. So right now, with what we've identified with our first phase of distribution, we're probably talking about 20,000 masks. And then we're going to continue to build off that.
And those would be mostly senior living facilities?
Density with buildings. Why that? Because that's where our cases are now. Syracuse Housing Authority, assisted living, independent living, La Liga, other community-based groups in the New American community to make sure that they're getting them. We're going to then build off that to other buildings with density, other areas where people congregate, whether it's the grocery stores, and we'll continue to do that as long as we have the masks available.
How optimistic are you with that 63 people recovered today, that trend might continue?
I'm very happy with the active cases, and we're coming up with positive cases now, and we're kind of like taking our medicine right now with some of these positives that we found. If we didn't find them now, we would get them later, right? And we'd get them later, and probably too late for certain people, and they wouldn't do well. So when I see the positives now, I'm happy because we found these hidden pockets of spread. It's concentrated spread, so it's not community, but it was hiding, and the community spread continues to go down. So we continue to social distance. That will help the community spread. Out of our active cases, remember, we're talking about proactive, affiliated cases. We've been talking about that all week. A third of our active cases are in that category. So hypothetically, that problem goes away in a couple weeks. And so then your active caseload looks a lot different in 2 weeks from now. And right now, we're at the point where we can fight this virus in real time right now. And we need to be able to continue to do that. How do we get it even better? We distance, we continue to mitigate it. So eventually when a restart happens, that we are really, really in a powerful position to go track this thing down.
Ryan, I'm actually surprised you're here and not in line for Pizza Frites on Erie Boulevard. But there is a line 1 mile in each direction. Traffic
Oh,
is
boy.
backing up to 690. Just
In their cars, I hope?
they're in their cars, from
Okay.
what I know. I haven't been there myself, but we're seeing lots of traffic in that area. Just your thoughts on, I don't know, what does that mean? Does that show people are not only physically hungry, but literally hungry for some return to normalcy?
I think Pizza Frite is really good. So I think that you take advantage of these opportunities to buy Pizza Frite. I'm glad people are in their cars, but I think you're right. I think there's a psychology to this, and it makes people hopeful and think about the future. So I'm happy with that. I'm not getting Pizza Frite, Andrew. As many people donate very good baked goods to my office, I'm on a keto diet. So if you want to send me a steak, I can eat it. But I can't eat these lovely baked goods that everybody keeps sending up to our office. I want to thank them. My staff is really enjoying that, and all the departments are. Any more questions? Okay. We have many folks at home who are creative. And Katie McKee is a freshman at Fabius. And she loves the briefings. She's actually taken advantage of the briefings with creativity. And she now has a workout routine based off of how many times I say quarantine. She will do jumping jacks, sit-ups for Starve the Virus. And she complained I wasn't saying it enough, so she wasn't getting a strong enough workout. So we've concentrated our quarantine and Starve the Virus over the last 2 days to make sure Katie's getting her workout in. And I think she owes me a bunch of jumping jacks, sit-ups, and burpees. So Katie, thanks for tuning in. We love your creativity. And overall, in this data, there's the stark reality of what this virus is and how it impacts our neighbors. There's also the reality of the community's response and the success we're now having, and we need to continue to have that. We're still going to have dark moments moving forward with folks leaving us too early, but we're getting through this. We're getting through it together, and we got to continue to fight this virus together. So please be safe, and we will see you tomorrow.